Understanding leukemia chemotherapy, methods of administration. Leukemia is a type of cancer that affects the blood and bone marrow, and is characterized by the abnormal growth of white blood cells. Leukemia chemotherapy is a common treatment option that involves the use of strong drugs to kill cancerous leukemia cells. However, the type of chemotherapy and the method of administration can vary depending on the form of leukemia and the individual patient's needs. There are several ways to administer leukemia chemotherapy, including oral medications, intravenous 4 injections, and catheterization. Oral medications are typically given in pill form and are swallowed by the patient. 4 injections involve inserting a needle directly into a vein and delivering the chemotherapy medication into the bloodstream. However, for some patients, 4 injections can be difficult or uncomfortable due to repeated needle insertions. In such cases, a catheter may be used as an alternative method of administering chemotherapy. A catheter is a small tube that is inserted into a vein in the upper chest and left in place. The chemotherapy medication can then be delivered through the catheter during each treatment session, without the need for repeated needle insertions. Another method of administering leukemia chemotherapy is through injection into the spinal fluid. This method is used when the cancer is believed to be a threat to the brain or spine, as the blood vessels may not be able to deliver the medication directly to these areas. However, this method can be painful for some patients, especially children, so a catheter may be used instead. In this case, the catheter is inserted under the scalp and allows the chemotherapy medication to be delivered directly to the brain. Leukemia chemotherapy is typically administered in treatment cycles, which involve a few weeks of treatment followed by a recovery period to allow the body to rebuild and prepare for the next session. It's important to note that there are other types of chemotherapy being developed and tested for leukemia treatment. In conclusion, leukemia chemotherapy is an effective treatment option for this type of cancer, and the method of administration can vary depending on the patient's needs and the form of leukemia they have. Your healthcare provider can help you determine the best treatment plan for you or your loved one, and provide support throughout the process.